drugs for the pharmacology final exam. And we're going to start from the end and go to the beginning. Alright, so first we're going to talk about toxicity, and I'm going to be going with my notes here, but I'm also going to be teaching it. So we have toxicity, which is an adverse medication, an adverse medication effect that is considered severe or life-threatening. And toxicity can be caused by an overdose of the medication, but it can also occur like when you give a therapeutic dose of the medication as well. You can also experience toxicity. And you can also, this includes hepatotoxicity and nephrotoxicity. All right, next we have our PDE and 5 inhibitors, which include our aphil drugs. And my trick for this, so this helps the male genitalia become erect, and so I think of, and how this works is it fills the male genitalia up with blood. So we have our aphils, which fill up the male genitalia, and these are our PDE5 inhibitors. And if you're on PDE5 inhibitors, or if you're currently taking another drug, if you're currently taking nitrates, then you cannot take PDE5 inhibitors because that can cause fatal hypotension. Grapefruit juice can increase your concentration of PDE5 inhibitors, so don't want to drink any grapefruit juice. Don't drink alcohol, and don't take any beta blockers. Or if you're already taking beta blockers, you need to find a different PDE5. You need to find an alternative for a PDE5 inhibitor. All right. So next we have, and forgive me for my pronunciation on these because this is gonna be horrendous, oxybutynin, and that decreases urinary continence. So from what I understand, that's going to make you pee less. Thank you. Well, I appreciate that. We have a podcast playing back. I don't want that playing. Anyway, so we have oxybutynin, and that decreases urinary incontinence. So for someone who is incontinent, it's going to help them not urinate as much. So for someone with like an overactive bladder or something, oxybutynin, again, I'm just going to say the name so I remember it. It's for me, because I'm the one taking the exam. And your contraindications for oxybutynin are glaucoma, a paralyzed stomach, GI or GU obstruction, or urinary retention. I've been playing violin since I was like 5, and I'm 19, so. Okay, next we have botanical, and that is used for non-obstructive urinary retention. Botanical. I need like a good trick to remember that. I'm trying to think of one. I can't think of one. My brain is too tired. Okay, so our side effects for botanical, because that is an cholinergic. That's a cholinergic. So it's going to cause what I call the sludges. So that's our salivation, lacrimation, urination, diarrhea, GI distress, emesis, and sweating. Yes. Alrighty, next we're going to talk about my favorite. I'm just kidding, it's not my favorite. Our diabetes medications. So we have sulfonylureas. And so the drugs that are in this class are glipizide, glyburide, and glimepiride. However that you say that. Some adverse effects of this drug are weight gain and hypoglycemia for your sulfonylureas. So for our like, patient teaching for this drug, you want to make sure that you monitor for signs and symptoms of hypoglycemia and teach a patient to make sure they check their glucose and how to check if they're hypoglycemic, which is cold and clammy, eat some candy. So you're hypoglycemic, you need to, increase your blood sugar. Also as a nurse, you want to make sure you're getting a point of care glucose and teach the patient about carrying around 15-gram carb snacks at all times. And to notify their healthcare provider if they're getting recurrent hypoglycemia. Make sure you wear a medic alert bracelet. Check your blood glucose before meals and at bedtime. And don't drink alcohol. Just don't drink alcohol. It's not that hard, guys. No alcohol. Because you'll get a disulfiram reaction. Alright, so glucagon. You would give this to someone who was unconscious and who was hypoglycemic. Okay? So like someone who's overdosed on their insulin, give them some glucagon. Okay? And they, like, if they're unconscious, so they obviously can't eat because they're like, so give them some glucagon. Okay? Metformin. So that's used to control blood glucose in those with type 2 diabetes mellitus. So, you have high blood sugar. You need to lower your blood sugar. I'll give you some metformin. Yeah. Okay. So some side effects and adverse effects of taking metformin will be GI effects. So just take metformin with your food. Make sure you're on a B12 and folic acid supplement because you'll be losing that. You will lose weight on metformin. And good thing about metformin is it does not cause hypoglycemia. Alright, so our patient teachings, we want to monitor for weight loss, which in an overweight patient, this would be a desired effect. But if it's like more than 4 kilograms a week, then, we want to, that's a lot. That's a lot of kilograms. Provide the supplements, the B12, the folic acid. And this is important. So if you're on metformin, you want to make sure that you stop the drug 24 to 40 hours before you get a iodine-containing contrast media injection. And then don't begin taking metformin until 48 hours after the procedure. All right. So now my favorite part, the insulins. We have our insulin, so we have our rapid acting. And my trick for remembering, because so I remember all the rapid acting. We Lispro, Aspart, and insulin glulicine. Okay. So glulicine for I don't know why this helps me remember, but Lispro, I know that's rapid acting. I remember Lispro goes with glulicine. Okay. Onset of action 15 to 30 minutes, peak 30 minutes to 2.5 hours, duration 3 to 6 hours. Key here, you want to know the peak 30 to 2.5 hours. That's the one you want to remember. Okay. Short acting, regular. Regular people are short. Whatever makes you remember it. Okay, 1 to 5 hours. A regular short person is going to be 5'1". 5'1", height of 5'1". All right, intermediate onset, that's going to be our NPH, and our peak is going to be 6 to 14 hours. Okay, that's important. Prolonged duration insulins are going to be our glargine and our detamir. Okay, So, again, trying to just, decipher these from our sulfonylureas, which, by the way, you want to check for a sulfa allergy with those. I'm going to remember that glargine has 2 G's in it, so it's, extra long. Okay. All right. We did it, guys. We got through the insulins. That's great. Alrighty. So next, it's gonna have 6 questions on it. Isn't that lovely? Okay, so next, this chapter. Don't even get me started. This chapter has 9 questions. 9 questions. All right, laxatives. Okay. Wait, hold on. Hold on. I think we're missing something here. Maybe we are. I'm missing antithyroid drugs. I wonder where antithyroid drugs went. I guess we'll never know. Okay, well, whatever. I can't remember what the antithyroid drugs are. So we're just gonna skip those and go on to the glucocorticoids. So glucocorticoids in zone or lone, and you give them to someone who has a malfunctioning adrenal gland. So like if you have Addison's disease or something. They also reduce inflammation, and they block the body's immune system. So if you have if you have autoimmune disorder. Okay, so some adverse effects. Obviously suppress your adrenal gland because that's what it's meant to do. Cushing's syndrome, which is caused by long-term uses of the glucocorticosteroids. You can get osteoporosis, which is crazy. Hyperglycemia, myopathy, muscle pain. You can get an infection because it's immunosuppressant. You can have electrolyte disturbances, and it can suppress your growth of your child. So best not to take those of your child. All right, levothyroxine. I don't know how I remember this one. Levothyroxine. It's used to treat hypothyroidism and goiter. I never learned how to say that. I probably did learn how to say it, I just forgot it. But that is another hypothyroidism drug. Okay. You can take it 30 to 60 minutes before breakfast. Okay, not during breakfast. Okay. You will have increased heart rate. Or you could get increased heart rate, sorry. And you want to report signs and symptoms of hyperthyroidism because that could be an overdose in the drug, okay? Increased heart rate, hot and sweaty. Okay, think you're running a lot, you're hyper. That's your, toxicity of the drug, okay? All right. Don't stop this drug abruptly. You will have a rebound to hyperthyroidism, okay? And you want to make sure you take this drug 4 hours before any other meds that you take. Don't ask me why, because I don't know. Okay, so next we have biophosphates. And I remember this one because my little brother wants a drone. And so I remember he wants to buy a drone. Okay, so biophosphates and then dronate. Okay, so these are prophylaxis treatment for postmenopausal osteoporosis. Also male patients with osteoporosis. But prophylaxis for postmenopausal women. Okay, so this one has a really odd adverse effect. At least I think it is. And it's esophagitis and esophageal ulceration. So you obviously want to report that to your healthcare provider, but also keep in mind that you need to sit up for 30 minutes after this drug because you will kill your esophagus, okay? It can also cause your jaws to lock up. No, sorry. It can cause your jaws to decay and rot, which is so wild to me. It looks disgusting too. It looks horrifyingly disgusting. Just don't take drugs, guys. Okay? So biophosphates, dronate, jaw, esophagus problems. If you swallow a drone, it's not going to end well for you. All right, so when you're taking biophosphates, you want to make sure you take it with 8 ounces of water on an empty stomach. Sit upright. Don't get esophagitis. Okay? Always report difficulty swallowing or heartburn. Okay? And you take this once a week, and you want to get a bone density screening every 2-ish years to see if the drug is actually working, because if it's not working, why are you taking it? Okay? If it's not working, why are you taking it? I mean, why are you taking it in the first place? But whatever. So, on top of this, go ahead and perform your weight-bearing exercises at least 30 minutes a day, but I know you won't do it, so why am I telling you to? Protocol, okay? Okay, take your vitamin C, take your calcium, okay? Best source of vitamin D, the sun. But no, we're taught to tell you the sun's bad for you, so drink your fortified vitamin D in that hormone milk that they make you buy at the store so that you can get hormone issues, and they can sell you more drugs to fix your hormone issues. That's how the hospital works. Okay, guys, so enough of that, because you know I could get canceled. Okay. You're gonna love this one. Okay, pause for 1 second. I'm missing page 13. I'm missing page 13. Oh, there it is. Okay. So we're gonna go ahead and just finish talking about antithyroids really quickly. Okay. So antithyroids, you have hyperthyroidism. Okay. All right. We have propyluracil, propylthiouracil, and then methimazole. Methimazole. What an interesting name. So effectiveness of this drug is determined by weight gain, decreased T4 levels, absence of hyperthyroidism. So remember, hyperthyroidism is your anxiety, tachycardia, palpitations, increased appetite, cramping, heat intolerance, sweating, fever, okay, sweating, diaphoresis, whatever. Weight loss. Remember, we want to gain weight in these patients. So gain weight. Methimazole, propylthuracil. Okay, gain weight. All right. And then versus your hypothyroidism. So remember, hyper, you want them to gain weight. Hypo, they're going to be losing weight. Okay? It doesn't really make sense in my brain either. I just want to double check that actually, because I need to make sure it makes sense in my brain too. Okay. Hypothyroidism causes you to gain weight. Hypothyroidism causes you to gain weight. Okay. So if you're taking like levothyroxine, which treats hypothyroidism, then you're gonna lose weight. Okay. That makes sense. Okay. Back to over here, because that page is all over here for some reason. Okay. We're gonna skip over sulcrophate and go right into misoprostol. Misoprostol. Okay. So if you overdose on ibuprofen, which can cause GI upset, you get an ulcer in your stomach, and guess what? You're gonna be on misoprostol. Okay, it's gonna treat your ulcers in your stomach. It's gonna give you a protective lining of your stomach. Okay, so think of it like this: miso pro. You get the pro miso soup, and it's gonna line your stomach. It's like the appetizer for the sushi. Okay. The effectiveness is determined by reduced pain. All right, antacids. I don't know why someone would take this, but they would. So what the heck? So you want to drink it with water or milk. You want to administer it 2 hours before any other drugs to prevent interactions, because remember, antacids decrease GI absorption. They decrease the acid in your stomach. Okay, it's freezing in here. They're going to decrease any drug, okay, that you take. So remember, don't take it with other drugs. Okay. Hear what I said? Okay. If you have heart failure or hypertension, don't take antacids with sodium. You will retain your fluid and you will die. Okay. Monitor electrolyte levels, CNS depression. Antacids can make you constipated, and they can also make you diarrhea. So why are you taking them when they cause constipation and diarrhea? Don't ask me. All right, H2 receptor blockers. So these are our tadines. So remember, like like 2T, 2. I'm gonna remember like H2 blockers, or H2 receptor blockers are tadine. All right, these are first line for ulcers. Okay, tadine. So think when you go tadine, and you stab someone like a little like sword, like tadine, you're like stabbing ulcers in their stomach. That's how I remember it. I don't know. Okay, so it treats those ulcers and is used for short-term treatment of GERD and PUD. Alrighty. So what are some interactions with this drug? Well, it will increase levels of warfarin, so you could bleed to death. Okay? Just don't. If you smoke while on this tadine, then it will decrease the levels of effectiveness, so you'll get more stomach pain. Okay, so just don't smoke. Okay? Don't smoke. It'll cause constipation. It can cause confusion in older adults. Don't drink caffeine. Don't smoke. Don't take aspirin. It's usually taken twice a day, and then you'll get moved to, I think, just one time before nighttime. HS. Notify your healthcare provider if you have GI bleeding. That is coffee ground emesis, black tar stools. Anything of that matter. Take 30 minutes to 1 hour before eating. Okay, so most of these drugs are before eating. Okay. Because, tadine, you want to protect that stomach, okay, from the ulcers, okay. Proton pump inhibitors. Okay, we have our Prazole. Okay. These treat gastric and duodenal ulcers. Okay. Prezol, proton pump inhibitors. They treat our Prezol. Prezol. So then when you eat a pretzel, it's like kind of can be like, you know, when you eat a pretzel, it's all crunchy, so it like stabs your inside of your stomach, and it causes you to have a duodenal ulcer. Isn't that fun? These are stomach ulcers. Okay, so this causes osteoporosis, which is wild, and rebound acid secretion if you stop it abruptly and whatnot. Alrighty, we're moving on. Next, we have, of course, I like log out of the entire thing. Alright, so next we have our sulcrafate. Sucralfate. Okay, so this treats our peptic ulcer disease, PUD. It's a mucosal protectant, and it creates a protective barrier that sticks onto the ulcer, and its evaluation is determined by reduced pain. Okay, it's that simple. So just remember it, and you'll be good to go. Oh, all right. Now we got our surfactant laxatives. Okay, those stool softeners, aka Colace. Okay, docusate sodium, stool softener. Alrighty. So it relieves constipation in pregnancy. And opioid use. So if you're on an opioid, take some docusate sodium. And it prevents painful elimination. Okay. So how it works is it increases the amount of water in the intestinal lumen. And it softens the stool because it allows water to penetrate your poo. Okay. Yeah, that feels good. All right, next is lactulose, okay? That we give to patients with encephalopathy. Encephalopathy. Okay. It can be given for constipation, but also given to prevent and treat encephalopathy. All right. We are on to chapter 44. This is fun. HMG CoA reductase inhibitors. All right, so these are in statin. Okay, these are cholesterol drugs. Statin, cholesterol. Remember, statin goes with cholesterol. Okay. Alrighty, so we have our these are statins. Okay, baseline labs. We don't really need to know those, but they are good to know. And we do need to know them, but I'm too lazy to read them. Okay. I know we're supposed to know them. Okay, I'm a bad person. But I'm gonna skip them. If I need to know them, you can blame it on me. One second. Okay. So, nursing interventions, okay? Monitor your liver function test and observe your patient for jaundice, abdominal pain, anorexia for liver stuff. Monitor your creatinine kinase if the patient complains of myalgia. And don't take alcohol. Take this drug with food, your statins with food. Don't stop abruptly taking them. Get an eye exam. Myalgia should be reported for rhabdomyolysis. It takes 2 to 4 weeks to become effective. Don't drink grapefruit juice while on this drug. Just remember to monitor your creatine kinase levels. And then brown pea is normal. Okay. Brown pea is normal. Alrighty. Oh, this will be fun. Okay. Clopidogrel. It treats myocardial infarctions. Okay. Alright, well, more like it prevents the reinfarction of them. Okay, so like if you have an ischemic stroke or something. Contraindications. If you're literally bleeding, don't take this drug. Okay? Because it's going to stop clotting, the clot formation. Okay? So if you take clopidogrel, it's going to stop those clots from forming, and you're going to bleed to death. And the point of this drug is to save your life, and so if you take it and you're bleeding, it's going to kill you, which is not what we want to happen. Okay, so next is warfarin. Okay, so this drug is used to treat your DVTs, thrombus formations in the legs. Also, it's good to give with those who have AFib or are on a prosthetic heart valve. It prevents myocardial infarctions, TIA, peripheral edema, and DVTs. Okay. With warfarin, we want to monitor the PT-INR, and how I remember that warfarin goes with PT-INR is that PT and INR are in war with each other. All right, got it. You will not screw that up in your test because you remember that PT and INR are both at war with each other. Alrighty, I'm glad we got that under control. Alright, so warfarin is highly protein bound, so if you give another highly protein bound drug, it's going to displace warfarin, causing it to go up. It's going to cause it to go up. The therapeutic level will stay the same, but the drug concentration in the blood will go up because it's going to be knocked off those proteins, and you will bleed to death. Okay? It is a pregnancy category X. If you're pregnant, do not take warfarin. Okay? Okay. Make sure you are put on all bleeding precautions, including letting your dentist know that you are on warfarin so they don't brush your teeth too hard and cause you to bleed to death because they accidentally brush your teeth too hard. Okay, don't be crazy. Don't play contact sports. Don't take aspirin. Okay? Don't take any over-the-counter drugs because they could just cause some odd interactions. Wear a med bracelet. And eat a consistent diet of vitamin K. So if you eat a lot of vitamin K, keep it consistent. If you don't eat more vitamin K because vitamin K just happens to be the antidote for warfarin. Okay. You want to med rec your patient before you start them on warfarin and get rid of those drugs as much as possible to prevent interactions. Okay. Remember to monitor that PT and INR and notify your provider if it's greater than 3. Okay. Next, we have heparin, which can be given orally. It is kind of the same thing. And remember, you monitor that APTT and your PTT. Okay. Some interactions with this one are protamine sulfate, which just so happens to be the antidote. This is a pregnancy category C, so, you know, hey, they say it's okay to use a pregnancy. So whatever. Okay. We don't argue. Alright. We got our calcium channel blockers with our dipene. Tropine. So our dipines, our mills, our dills. Except for diltiazem. Okay, that's our calcium channel blockers. This is first line for African Americans. Okay. Yeah. Our adverse effects are peripheral edema. Okay. Monitor blood pressure, heart rate. Get your heart rate prior to administering your DPNs, calcium channel blockers. Get your daily weight, monitor INOs, check your glucose, and your potassium levels. Don't abruptly stop taking because you'll get rebound hypertension and slowly rise when standing and sitting, whatever. Report chest pain or shortness of breath immediately. And don't take statins because, there's something about statins that I was looking at. It's not coming up though. Where was it? Well, I can't find it, but it says not to, so don't. Just do what you're told. So don't take statins. Great for juice. Oh, because it increases the level of calcium channel blockers. All right, clonidine. It's also used for hypertension. And clonidine cannot be used in pregnancy. There's a transdermal patch, and you can change it every like 7 days or something. Get a daily weight. Clonidine. Clonidine is used for hypertension in giants. Because I don't know, clonidine just sounds like a giant. That way they only have to come to the doctor every 7 days to get it changed. Because they're so tall. Okay, so we have our pills, our ACE inhibitors. Okay, so this is first line just in general. Remember, calcium channel blockers are first line for African American. Our side and adverse effects are the cough. Okay, remember pills, you're always coughing. It's that dry cough. We could have hypotension. And just remember that you don't want to be pregnant while taking ACE inhibitors. Also monitor for angioedema, swelling of that face and neck. Angioedema is more of swelling of the neck and stuff, but you could also check the face. If the patient is complaining of the ACE cough, then you can switch them to an ARB. African Americans do not respond to ACE inhibitors, and they're not as effective. So just remember, first line for African Americans is, your thiazides, your calcium channel blockers, your beta blockers, not your ACE inhibitors. Okay. Good talk. Okay, so next we have our diuretics. I just love diuretics because they make so much sense. We have our potassium sparing, so you're gonna get a lot of potassium in your body. We have your spironolactone, triantramine, amiloride, and then some other one I don't want to say. Starts with an E. Okay, so watch out for hypokalemia. Because, sorry, these are potassium sparing, so they're gonna collect a lot of potassium. So you want to treat it with, you would take this medication. Let's say you would pair this medication like spironolactone, you'd pair that with a potassium wasting diuretic. So look, we give drugs, they cause problems, so we give them another drug to fix the problem. So that way they pay more money and the hospitals make more money. Okay, that's how healthcare works, guys. Create a problem so we can fix the problem. Okay. All right, so our adverse effects, hyperkalemia, obviously, because again, these are potassium sparing. It's going to cause that fluid to get out of the body. Potassium's going to go up. Okay. Nausea, diarrhea, these abdominal cramps. It really sucks. Okay. So don't eat potassium. if you're on spironolactone, because that's already, it's gonna, you know, collect potassium. So, you know, don't eat those bananas, potatoes, avocados, things like that. Okay, we've got our thiazides. I love thiazides. There's quite a bit of them, but the main one is that long one, the hydrochlorothiazide, HCTZ, and your hydroflumetazide or whatever. And you give this, and if a patient has like heart failure or edema, like really bad edema contributing to heart failure, and it's essential in hypertension treatment. All right, so remember, this does work on African Americans, which is great. The effectiveness is determined by if your blood pressure goes down, because that's what we're trying to get it to go down. Decrease edema. If you have less edema and you're on this drug, then hey, the drug worked. That's great. If you start breathing better, you know, your shortness of breath goes away. Great, the drug is working. Thiazides, I don't know how they affect potassium though. All right, we have our loop diuretics. So this is our furosemide, fast and furious, gonna get that fluid out of the body. All right, so if you're like in chronic heart failure, give me some furosemide. Get that fluid out fast. Okay, rapid mobilization of that extra fluid, of that extra edema. So if you're on this, obviously, you know, rise slowly. You have a lot of fluid changes. You want to take these drugs in the morning. Okay. Check your blood sugar if you're diabetic, because, you know, fluid shifts in the blood. This can cause different, you know, levels of glucose in the blood. Okay. You want to eat foods high in potassium with your loop diuretics. Remember, loops are potassium wasting. Okay, so eat that potassium up. Bananas, potatoes, dried fruit, tomatoes, nuts, apricot, spinach, citrus fruits. Avocados are actually the highest in potassium, but hey, they don't mention that because they don't want us to actually eat high in potassium foods, so they can put us on spironolactone, which is a potassium sparing. See what I mean, guys? It's all a scam. Alrighty. Just make sure you monitor for hypocalcemia, hypokalemia, which is, you know, your potassium. You don't want to take that sodium because it can cause more fluid retention. We do not want fluid retention. Weigh yourself at the same time every day. Wear the same clothes. If you're gaining weight, that's a problem. Okay, if you're losing weight, that's a problem. Okay, but mostly the weight gain is a problem. Weight gain is a problem because that's not fat you're gaining. That is water retention, and that is not what we want. If you are in chronic heart failure, you will die. Okay? Okay. All right, so effectiveness of our loop diuretics, remember those are potassium wasting. Decreased blood pressure, decreased edema, decreased dyspnea, decreased crackles, and you live. Isn't that nice? I know. Such a great outcome. Alrighty, guys. So we are on to our cardiac glycosides. I am not a fan of these drugs, but we're going to go over them. So, digoxin, okay? So that treats heart failure. Atrial fibrillation, atrial flutter. It slows the ventricular rate in those. So we're going to give this drug with someone with heart failure, okay? So some side effects, adverse effects. It's going to slow the heart down. Bradycardia. If we have a low pulse, less than 60 beats per minute, I think we're going to hold the medication. If your heart rate is less than 60 beats per minute. This causes nausea, vomiting, diarrhea. Okay, big ones here, big adverse effects here. Anorexia, okay? And we're going to have diplopia, we're going to have blurred vision, we're going to see those green halos. Okay, we want to watch for that. We're going to monitor the serum digoxin level of 0.5 to 2. Alrighty, monitor that potassium. Don't know why, but we will. Okay, next are nitrates. These are important drugs because they have a lot of contraindications. Wear gloves when you administer this drug or your blood pressure will drop, okay? If you're on this drug and you experience angina, why don't you give yourself some of that, okay? Give yourself some nitroglycerin, okay? If within 5 minutes your nitroglycerin does not cure your angina, call 911 immediately and apply another dose. You can take a max of 3 doses of nitroglycerin, okay? Date where you put those patches. If you're taking the dermal patches, you don't want to have 2 on at the same time. You can die of hypotension. Just be careful of orthostatic hypotension, you know. And if you abruptly stop this drug, you could experience reflex tachycardia, so, you know, don't stop it. So our contraindication, this is pretty important. Don't be on those PDE5 inhibitors, okay? Those affils. Remember, the PDE5 inhibitors are for the male genitalia. They're going to affill the male genitalia to help with erection. So you don't want to be on those at the same time. You will die of fatal hypotension because the affils, they dilate the blood vessels so that blood can get down to the male genitalia and help with erection. And then your nitrates are going to be lowering blood pressure. If you have hypertension, if you take them at the same time, you will die because your blood pressure will get so low. Okay, don't do it. Alrighty. That's all for that. So we're going to move on and talk about our decongestants. So I actually don't mind these drugs. These drugs aren't too bad. There was 8 questions on cardiac glycosides. That's insanity. That's insanity. We have 1 question on this, and it's like, it takes up a whole page. What the heck? So we have our Sudafed, pseudoephedrine, phenylephrine, all those decongestants. Those temporarily relieve you of nasal congestion, so they're gonna constrict those nasal, you know, blood vessels so you can breathe. Remember, so we're just gonna dry us out. So we got all of our sludges, stuff going on. Check for hallucinations, adverse effects. We're gonna have palpitations, hypertension, arrhythmias, things like that. Don't take this drug if you have a glaucoma or if you have pre-existing hypertension, because decongestants constrict the blood vessels. And what is hypertension? Constriction of the blood vessels. Okay. Okay, I need a trick to remember this one. Methylaxanthines. That's our theophylline and aminophenylline. Okay. Oh. Yeah, I need a trick for this one. I can't give a trick for this one. All right. So relief of asthma. Okay, I think I have my trick. Feline needs relief of asthma. That's how I'm gonna remember it. Feline. Yeah, that's how I remember it. Okay, so this is temporary relief of asthma. It's not going to cure asthma, but it will reverse bronchospasms. Don't smoke. In general, don't smoke, but don't smoke while you're on this drug, and don't drink caffeine. Again, that's going to, you know, cause you to be all crazy. Don't drink caffeine, tea, soda, chocolate, which has caffeine in it. All right, mucolytic. Our mucolytics, we have acetylcysteine. That smells like rotten eggs. So teach your patient about that. It's also the antidote for acetaminophen, aka Tylenol overdose. All right, beta-2 agonists, we have our alols, you know, albuterol, all those things. It's used to treat acute bronchospasms. Remember to take your bronchodilators first, and then take your corticosteroids when using MDIs. Okay, meter dose inhalers. Sinus tachycardia, hypertension can be a cause of this, or an adverse effect. Palpitations, angina can be an adverse effect. Yep. All right, and our held corticosteroids, we have our zones and our loans and our ides. Can also be used in a prophylactic treatment of asthma. Okay. So I'm going to use those every day. The drug peaks in about 1 to 2 weeks, so if it's not working, just keep taking it, okay? They decrease inflammation, the corticosteroids do. Just make sure you rinse your mouth out afterwards to prevent super infection. Next is epoetin alpha. It's used in chemotherapy. It's used in CKD, chronic kidney disease. I'm just guessing that's what that means. Okay, it increases red blood cell production. It can cause hypertension, and it can increase the risk for a thrombotic event. Overprolken, which is treats thrombocytopenia, which is platelet formation. That increases the formation of platelets. For those receiving late transfusions in chemo and stuff. If your platelet count is greater than 50,000, you are good, okay? And that's the effectiveness is evaluated. Alrighty. Tamoxifen. Breast cancer. Yeah, it stops the growth of breast cancer cells, okay? This can cause vaginal bleeding, endometrial vaginal cancer. So, take a drug to give you another cancer so they can treat that cancer. You want to get a yearly pap test. Cause bleeding in the vagina. Hypercalcemia. Tickler bone pain and that. You can get blood clots too. Tamoxifen. Tam has breast cancer. Okay. It's sad, but that's how I want to remember it. Alrighty. We have our INH, used to treat TB. Remember to take your B6 when you're on this. Don't eat triamines on when you're on INH. What does INH stand for? So I'm trying to think. INH. Oh yeah, I remember. All right, we have our aged cheeses, our pepperoni, our salamis, our avocados, figs, bananas, smoked fish. Basically, what I eat. Protein, dairy supplements, soup, soy sauce, beer, wine. Take it on an empty stomach 2 hours after food. This is going to cause your birth control not to work, so use Berry method. Don't miss your doses and report signs and symptoms of neuropathy. That's going to be caused by your B6 deficiency, and you can correct that by taking a B6 supplement. Okay. Acyclovir, that treats a viral infection. Acyclovir, I think like bicycle, and all the bugs flying around out there, you get sick easy, All right, so that's our varicella zoster, herpes simplex virus. Okay. Next, we have our fluconazole. Okay, that's an antifungal. It stops the growth of fungal infections. I think there was another azole drug that I was like ozole or whatever. I'm gonna go back and look for it, like maprazole or something. Watch me never bother find it though. Of course, that's how it goes. Of course. Well. If it comes up again, I will check it out. Oh, there it is. Yeah, azole. Metronidazole. It's not. That's for vagina. Because people at the metro are weird. Okay. That treats the vaginal stuff. And it causes CNS tox in urine discoloration, like a red-brown. Makes you taste all this metallic stuff in your mouth. Oh, we haven't got there yet. That's why. I was like, I don't remember talking about that. All right, so our azoles, you know, fungal infection, stuff like that. Alrighty. For quinolones, they end in oxycin. So remember ox. So remember, Quinn wants to ride the ox. Okay. Alright, so it's used for complicated infections in patients without an ultimate treatment to bacterial infections. Alright. So our side effects and adverse effects are photosensitivity, GI upset, Achilles tendon rupture. So think, you know, Quinn is about to ride the bull and then she ruptures her tendon. And then gets hypertensive. And then has crystal urine. And then gets a super infection. Okay. Aminoglycosides, we have our gentamicin. Aminoglycosides for gentamicin. Glycoside for G. It requires the peak and the trough. Okay. So get the peak 30 minutes after the infusion. And you want to get the, you know, trough right before you give the next dose. Okay. Alright, next. So vancomycin, we have Roman syndrome, which occurs when you administer IV too fast. Remember that severe hypotension, increased heart rate, red flushing, all that fun stuff. If it's not an allergic reaction, stop the infusion, give diphenhydramine, and restart the infusion at a slower rate. Okay. Autumn toxicity as a complication, it's reversible. Nephrotoxicity, Stevens-Johnson syndrome, things like that. Nursing interventions, obtain a culture sensitivity before you start this antibiotic. Monitor your peak and troughs and administer over at least 60 minutes, okay? And assess for hearing loss, all right, with this drug. All right. So next we're going to talk about cephalosporins. So this cephalosporins start with ceph or ceph. Penicillin start with cillin. Adverse effects, side effects, superinfection, C. diff, hypersensitivity, bleeding. Monitor for allergies, history of allergies, things like that. Allergic reactions usually occur within 15 and 30 minutes, so go ahead and just keep an eye on them. Get your culture and sensitivity beforehand. Go ahead and do that. That's great. And epinephrine is our antidote. Okay. Alright, so general patients about taking antibiotics. Remember, you want to increase your fluids. You want to take the food. Take your antibiotic with food. You want to report any allergic reactions. You want to wear like alert bracelet with your allergies. Use Berry method of birth control. Take probiotics. Eat foods with probiotics. Avoid alcohol like disulfide reaction. Yeah. NSAIDs, naproxen, ibuprofen, ketorolac, diflunac, meloxicam. Oh my gosh. They cause GI injury, hepatotoxicity, especially when you take them in high doses. Black box warning, cardiovascular event, okay, GI bleeding, things like that. Take it with food or 8 ounces of water. Alcohol is going to increase your GI upset. Okay, so just don't drink. Again, GI bleeding, watch for that. You can take H2 blockers, which are H2 acidine, which helps with the or your ulcers, you know. And then you could also give them omeprazole. and misoprostol for prophylaxis. Okay. PPI. I want to figure out what that is. Mesoprol. Mesoprol. We'll look those up in a little bit. Okay. Actually, no. Alrighty. So, next we have our aspirin. That's going to reduce our fever, suppress inflammation. It's also going to help not have a heart or myocardial infarction. Again, remember it's gonna increase absorption of warfarin, so you could bleed to death. Alcohol is gonna increase gastric bleeding, adverse effects, bleeding, renal impairment, silicism. That's an overdose. Rye syndrome. That can cause hypoglycemia. I forget what the antidote is to aspirin. I should know that. I'll ask Siri. What's the antidote for aspirin? Sodium bicarb. I know that. Anti-gout, so we have our colicine, that's acute. We have our allopurinol and probenecid, that's our chronic. So allopurinol take all the time. Probenecid take for prophylaxis. Colicine take acutely. Okay. Nursing interventions take with food. Don't drink grapefruit juice. Monitor uric acid levels. CBCs. Increase your fluid. It can have a metallic taste for allopurinol. Okay. All right. Methotrexate. It's gonna delay the worsening of RA. What could that mean? Methotrexate. What is that? Delays the worsening of RA. Rhabdo. No, what does that mean? I have to check in my handy notes again. Oh. Interesting. So it's an antibiotic, but you can take it for like, wait a minute. No, it's antifungal. No, it's not antifungal. Sorry. You can take it for vaginal trick. You can take it for C. diff. You can take it for RA. I have no idea what that is. Adverse reactions are like, obviously allergic reaction, phototoxicity, superinfection, dark urine, metallic tasting. That's normal to teach. Don't take alcohol. Disulfiram reaction. Take 1 hour before meals or 2 hours after a meal. Report any rash. Stop taking the medication. Report bleeding. Drink 8 ounces of water and use additional contraception. Okay. Alright, neostigmine is for myasthenia gravis. Remember that we need that drug called edrophonium to help determine whether we're in a myasthenic crisis or a cholinergic crisis. Okay. And cholinergic is going to cause meiosis. Okay, so small pupils. Because we're wetting out. We're getting rid of fluid, and so, yeah. Patient may be ventilated if they go into respiratory depression. So, the endophonium can determine which, if it's a, myasthenic or a cholinergic. But if you're in a cholinergic, you want to give atropine. If you're in a myasthenic, you want to give more of the medication. Central acting, we have dantrolene. I don't know why that one's underlined, but it is. Okay. We have baclofen and cyclobenzaprine. Don't really mess that up. Dantrolene. We'll just have to remember that, I guess. Dan likes to jump around in a central acting muscle relaxer. Oh yeah, dantrolene, you give it for like malignant hyperthermia. Yeah, I do that. Alright, so another effective way we can see that works is if it decreases pain and it increases range of motion. Our neuromuscular blocking drugs, they're kind of all over the place. But the ones I have underlined are non-depolarizing succinylcholine and panoseropinium, pancuronium, why is this hard to say? Pancuronium, and the adverse effects are respiratory arrest because they get paralyzed. Medication antidote is neostigmine. Don't ask me why, but it is. Wait, I just made that up. Okay, it's time to go to bed. Thank you guys so much for watching. I think I'm going to close this up, and we stopped at chapter 21, so we can pick that up later. Have a good night, everyone. Wish me luck in my exam, and good night. Bye.